We will talk about chronic sinusitis. It affects around 10% of adult population. And first, define what means sinusitis. Around nose, we have air-filled spaces, and we call them sinuses. These sinuses release mucus, and this mucus helps to clean air we're breathing. Sometimes these sinuses are inflamed and infected, and mucus builds up there, and it pressures around tissues and causes inflammation, and it's painful, and we call it sinusitis. If sinusitis lasts more than 12 weeks, we call it chronic sinusitis. Now let's say, what are the symptoms of sinusitis? First and most important symptom is pain. Pain around the nose, around cheeks, around forehead, and pressure sensation, pressure feeling is most important part of sinusitis. Why it happens? Because when mucus builds up the spaces, it pressures and it causes inflammation, adjacent tissues, and it causes pain, and we feel fullness and we feel pressure. You can see it's filled with pus, filled with mucus, thick mucus, and it pressures around tissues, and it causes pain, and it causes sensation and feeling of pressure. Second most common symptom is nasal congestion. It's logical because this mucus blocks nasal passages, and person feels nasal congestion because this mucus does not move freely into nasal passages, and person has sensation of nasal congestion. Third most common symptom is postnasal drip. Postnasal drip means that, yes, of course, this mucus is blocked, but it still moves slightly, and it moves anywhere it can. It means that some mucus moves towards throat, not towards nose and outside, but sometimes it moves lower part and moves down, and it irritates throat, and it causes sore throat, and person has feeling that something drips into his throat, and person has sore throat, person has cough symptoms because this mucus irritates throat. Fourth most common symptom is thick discharge from nose, which is yellow or green sometimes, and these colors, yellow and green, indicates usually bacterial infection. And this discoloration of mucus means that here is infection, here is pus, that's why it is thick and it has yellowish or greenish color. And person has loss of smell and taste because these receptors are damaged or blocked temporarily, so person can have loss of smell and inflamed receptors of olfactory receptors, and even olfactory nerves are inflamed, and person loses smell and taste. Sometimes headaches are common also. Person can have headache, especially when bends head forward. This headache can be increased. Now let's say, what are the most common causes of chronic sinusitis? First and most important cause is allergies. Allergens can cause rhinosinusitis, and rhinosinusitis and sinusitis are synonyms, so they are same. And allergies is most important cause of sinusitis. Dust, mites, dander, pollen, they can irritate mucosa and they can cause allergic reaction, and they can cause sinusitis, and if it's prolonged, then we have chronic sinusitis. Second most common cause of sinusitis is nasal polyps. Nasal polyps are small tissue growths which we call polyps inside nose, inside nasal cavity, sometimes inside sinuses, and they can block mucus passage, and we have chronic sinusitis. So nasal polyps are second most common cause. Third most common cause is deviated septum. Deviated septum means that the wall which located between our nostrils, you can see, is deviated. It's not in the center. That's the idea, and it can block also fluid and mucus passage. And we have other causes also, and they are not very common. For example, in case of weakened immune system, person can have chronic sinusitis during cystic fibrosis, during asthma, when person is smoker and smoking, frequent swimming also, and diving, and fungal infections. This fungal infection commonly associated with weakened immune system. So when we hear chronic sinusitis, we don't think about fungal infection, or we don't think about cystic fibrosis. We think first about allergy, then we think about nasal polyps, we think about deviated septum. Now let's say about treatment. First line treatment and most effective treatment is considered topical corticosteroids. They are nasal sprays like fluticasone or budesonide or mometasone. They are nasal sprays, and they can be used for long term. They have some side effects like dryness, irritation, or nosebleed, but they still considered most effective, and in many cases they can be used for long term. They are effective because they reduce inflammation, they improve symptoms, so they considered effective treatment. Second and more safer alternative, or sometimes combination with corticosteroids, is nasal saline irrigation technique, which means that you should irrigate your nose and nasal cavity with saline, with water with salt. That's the idea. Person gets lukewarm water and adds some salt, adds a small amount of baking soda, and use neti pot or bulb syringes or squeeze bottles. It does not matter. And idea is that you should leaning over a sink, tilting head sideways, and inserting the spout of the device into the upper nostril, and gently pouring or squeezing the saline solution. And it should pour from other nostril. That's the idea. You should irrigate your nasal cavity. It cleans. It's considered very safe. And then after you do for one nostril, you do it for another nostril. So it's considered a very effective method. It's considered also safe method, and it's possible also used for long term. Another treatment method is topical decongestants, such as oxymetazoline or phenylephrine. They are topical decongestants, but their usage is very limited, around 3 days, because they can have rebound effect, and it means that when you stop using them, symptoms return, and symptoms may return worse. So topical decongestants are not best choice in case of chronic sinusitis. Antihistamines are used also if there is major component of allergy, such as loratadine, desloratadine, or fexofenadine. They consider less or non-sedating antihistamines, and they can relieve symptoms of allergy. Antibiotics are used if there is bacterial infections, such as amoxicillin clavulanate, or doxycycline, or azithromycin, or clarithromycin, or levofloxacin, or moxifloxacin. They can be used in case of bacterial infection. Of course, misuse such antibiotics is not advised, and we have strong recommendations against overuse antibiotics because of resistance risk, because of side effects risk, and adverse effects risk. In many cases, using antibiotics, especially prolonged period of time, is not safe. And functional endoscopic sinus surgery is used. It's very effective if we have anatomical obstructions like polyps or deviated septum. It's very effective, and it means that mechanical cleaning of nasal passages, and it's really high effective. And what is prognosis? Prognosis is favorable in many cases, because if person is treating and gets treatment, he has 60 to 80, 90% probability that he or she will have long-term remission. But if left untreated, there is complication risk, such as eye infection or brain infection, and it can be fatal. So sinusitis directly does not affect lifespan, but indirectly it can cause serious complications such as brain infection. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my video, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.